Diabetes is a common lifelong health condition. According to Diabetes UK, there are 2.6 million people diagnosed with diabetes in the UK and over 500,000 people who have the condition but don't know it. That's about 1 in 20 people in the total population living with diabetes. Diabetes is a condition where your pancreas doesn't make enough or any insulin, or when your body is resistant to the insulin that it makes. This causes the amount of glucose in the blood to rise as it cannot be used properly. High levels of glucose will cause damage to your body over time. There are two types of diabetes. Type 1 diabetes is an autoimmune disease where the body does not produce its own insulin. People with type 1 diabetes need to have regular insulin injections alongside maintaining a healthy lifestyle. They also need to regularly monitor their blood glucose to try and maintain a steady level. People develop type 2 diabetes when their body is unable to create sufficient insulin for the body's demands, or where the insulin their body produces does not work properly. Type 2 diabetes is a metabolic disease that is more common in people over the age of 40 and is also more common in the South Asian and Afro-Caribbean, where it often appears from around the age of 25. Increasingly, more children and young adults are being affected by type 2 diabetes, regardless of ethnic background. Around 1 in 10 people with diabetes have type 2 diabetes. Adopting a healthy lifestyle and diet is the first approach to treating type 2 diabetes, with regular monitoring required to ensure steady levels of blood glucose are maintained. Often, though, insulin or other medications are required to treat type 2 diabetes.
Before I was diagnosed, I just lived like, I suppose, normal people do, doing basically football, some exercises. And then I was diagnosed with diabetes on the 1st of August 2006, and it was quite shocking. I was really upset by it, and then I was focusing on the negatives, but then I decided to focus on the positives to try and make myself feel better. And it has made me feel a lot better thinking about the positives. You know, when I was first diagnosed, I got chocolate for doing sport, which made me feel a lot better. You felt special because you were the only one doing it. And then I got my pump. That's just made my life a whole lot better.
Having diabetes doesn't mean that your life as you had was going to end. It doesn't mean that you have to give up everything that you enjoyed. Having diabetes is more about knowing how your body's going to react to certain foods, knowing how it's going to react to certain activities, sports, hot weather, cold weather, etc. It's all about listening to your body and monitoring your blood sugars, building up a pattern with the activities that you do. So you can have a normal, active life, but you might need to make changes to your healthy options. Sort of swapping diet drinks for full sugar drinks, etc. It doesn't mean having diabetes that you've got to give up all the things that you liked before that contain sugar as well. With the introduction of carb counting, you can actually count the carbs, so you can have chocolate, cake, all the things that have got sugar in, just in smaller portions. I count the carbs, I then do an insulin dose just to cover the carbs that I've eaten and monitor it before and after eating to make sure that I've got the ratio correct.
My blood sugar meter helps me simplify my diabetes because I can do it before meals, so I know exactly what my sugar readings are, so I can calculate it with carb counting, which is how many grams of carbohydrate are in your food, and it's equal to a special ratio that I have to follow. Then I got the Digit, which is a special glucose meter which you can play on the Nintendo DS, and it also has a special online mode. There's a special bit on the bottom that you just plug into your DS and then you can play, and there's like a special world, and you have to go through different levels and then you complete it and it opens more levels. And what you have to do is the point is to keep your sugar levels on target so you can get more points. So if they're actually on target, you'll get more points than if they're off target, so it makes you want to keep it on target.
The blood glucose monitoring it can be done at 3 points in the day to be structured so you can get useful information from it. First thing in the morning, it's normally the lowest, and we call that the fasting blood glucose. And a fasting blood glucose tells us how well the body's coping with the sugar levels overnight. And ideally that should be between 5 and 7, or it's individualised to a person. The other times that you can do is 2 hours post-meal, and 2 hours post-meal is helpful if you're learning about your diabetes to see which foods are affecting your blood sugars, or 2 hours post-meal quite useful if you're on insulin or on diabetes therapies on tablets to see if your own insulin is covering it along with the tablets as well. So 2 hours post, your doctor or your healthcare professional will give you more guidance on that. Other times that you might want to be looking at your blood glucose is pre and post exercise, so you can see the effect of exercise on lowering your blood glucose, which helps you adapt to a more healthier lifestyle. Testing your blood sugar is simple. You'll be supplied with a meter, which is a small portable device. You'll have test strips and you'll have a lancet. The lancet will allow you to get a blood sample from your fingertip, and then you put the test strip, which is connected to the meter, to take that test, and you'll get a result in about 5 seconds. The advantage of taking your blood sugar is that often as not people think they know what their blood sugar is, and sometimes their sugars could be high or low, and the symptoms of high and low sugar can be similar. So the only way to know is to test. When you're testing your blood sugar, it's a bit like driving a car when you're looking at your fuel tank, see whether you're full or empty, or you're running just enough fuel for the journey. So blood glucose testing is important because you can't always tell what you think it is, and a lot of people do believe that they know what their blood sugars are. Research evidence indicates that if the blood sugars are running too high, you're at more risk of complications of diabetes, such as eye problems, kidney problems and nerve problems. Therefore, keeping your blood sugars in the right zone enables you to have a healthier life. For diabetes, self-management is key, and technology is available to view your blood glucose results and tailor treatment around you.
Bayer Healthcare, including Bayer Diabetes Care, has been at the forefront of diabetes innovation for 40 years, always with the same simple aim of enhancing patients' quality of life and well-being. We're very proud of our innovative record, starting with Miles Laboratories' launch of the first glucose monitoring meter that was portable in 1969, up to the present day with products such as Contour and Digit, which are small, handheld, easy to operate and highly accurate devices. Bayer's highly recommended devices also come with the added benefit of connectivity software, which opens up a further range of management options for patients and healthcare professionals. The Contour blood glucose monitoring system offers patients an unparalleled choice of ways to manage their diabetes. Bayer is also revolutionizing the way children engage with diabetes management by tapping into an activity that they already know very well, and that's handheld gaming. Bayer's Digit meter strives to reward consistent testing habits by awarding points which the kids can then exchange for improved levels in their game, or an improvement or a change in the gaming experience. Bayer Diabetes Care is committed to developing innovative products that enhance the lives of patients and help those people to manage their condition as effectively as possible in a way that suits their modern lifestyles.